Hi, everyone. Thank you for joining us for our question and answer session. My name is Terry Lynn Macmillan, and I'm an Outreach and Education Advisor and will be today's moderator. We're here today to discuss and answer common questions we receive about our nursing programs. Today, I'll be joined by Beth Morris, Associate Dean of Nursing Programs for Mohawk College. Hello, Beth. Could you please share a little bit about yourself and any initial thoughts you'd like to share about your role?
Hello, and hello everyone. Thanks for inviting me. It's nice to be here. I joined the college early in 2019 as the Associate Dean of Nursing from a career in healthcare leadership in the hospital setting. I am a registered nurse, and I'm actually a graduate of Mohawk College nursing program originally. So I had a wonderful educational experience here at Mohawk, and I was really excited to be joining the college and the program that I had so many fond memories of.
Great, thank you, Beth. Your programs are very popular, attracting many applicants to the college. So let's get started. First up is the Personal Support Worker Program. There's a big demand right now for PSWs. Can you tell us what this program prepares graduates for?
There is really a significant demand for PSWs in healthcare right now. We know that a lot of the work is reliant on healthcare, and it is a real essential role in healthcare. The pandemic has really highlighted the importance of the care that the PSW provides, and our program at Mohawk College prepares students to become preferred graduates for the profession. Our graduates are making a real difference in the lives of individuals and families across the lifespan.
Great. And this program is 2 semesters in length. Does it have any lab experiences or clinical placements?
Oh yes, definitely. This program has a really nice combination of theoretical classroom learning taught in a blended manner, which is a combination of classroom and online learning, as well as hands-on experience in labs and simulated learning in our state-of-the-art simulation lab. The program also offers excellent in-person practical experience in professional practice placements where you learn to apply the knowledge that you've gained. So combining these 3 types of learning results in a fulsome and in-depth education that's interesting and is really well received by our students.
Great. And then in addition to the IAHS campus, we also offer the program in partnership with Six Nations Polytechnic in Brantford, as well as through a partnership with Schlegel Villages at Wentworth Heights. Can you tell us what students can expect at these 2 alternative sites?
Sure. Wentworth Heights is our on-site living classroom where students would experience the theoretical and lab learning in the morning, and then they head to the neighborhoods, which are the wards and residential areas where the clients live, to apply what they've learned. So the curriculum is the same as our other 2 sites, it's just delivered slightly differently. The really nice thing about this site is that the classes are very small, so with a maximum of 25 students in your group, you really get to develop some nice relationships with the other students that you're in program with. And being immersed in the actual area where you would be working as a PSW provides for a really rich learning experience as well. The program at Six Nations Polytech in Brantford is delivered completely by Six Nations Polytech. However, the curriculum is the same as the other 2 sites, and the credential is granted by Mohawk College.
Okay, and for anyone interested in this program, we typically offer starts in both September and January. So please be sure to check the website for upcoming offerings and for admission requirement details. So moving on to practical nursing, can you tell us what our practical nursing students experience in the program? And can you describe some of the classroom and clinical experiences that they receive?
Sure. So our students receive their theoretical learning in a blended format. Again, as I mentioned before, it's a combination of classroom and online learning. As well, lab and simulation classes are offered in our state-of-the-art professional practice laboratory or simulation lab. We also just call it the PPC, which helps to mimic an actual clinical setting and provide a very realistic environment in which to learn. And the SimLab offers both high and low fidelity simulation, and we use state-of-the-art mannequins and recording systems to contribute to that realistic learning experience. So you would walk in and it's set up like a hospital. You get the feeling of actually being in the clinical placement. So we have mannequins that can do lots of things, for example, mimic breathing. And so that provides a very, very realistic learning experience. I think that those elements of simulated learning in our program really offers our students an advantage when it comes to seeking employment. Our lab classes and professional practice placements are offered in small groups, and placement settings include acute hospital experiences as well as community and long-term care.
Perfect, thank you. And we know the practical nursing program runs continuously over 4 semesters. We're often asked if the program can be completed part-time or if students are able to keep jobs while they are in the program. Can you comment on that?
Sure. At this time, we don't offer the program part-time. However, it is possible to be employed while attending. We have lots of our students who are employed actually in healthcare in a role similar to a personal support worker. So they are, getting that experience of being in a healthcare system. Semester 1 is particularly demanding for several reasons, and also the pre-graduate placement experience at the end of semester 4 is full-time for 7 weeks. So I really think it's important for applicants to keep this in mind when they're considering the program.
And then when students graduate from the program, what next steps are required before they can become a registered practical nurse?
Well, in order to practice as an RPN, all practical nursing graduates are required to successfully complete the registration exam with the College of Nurses of Ontario. And then at that time, they would receive the registration as a registered practical nurse. Actually, I'd like to point out that some of our graduates are offered employment right from their pre-grad placements, which of course, those offers would be contingent on passing the CNO registration exam.
Great. So before we move on to the collaborative nursing degree, can you explain some key differences between a registered practical nurse and a registered nurse in the workplace?
So this is a common question that we get asked a lot. RNs and RPNs study from the same body of nursing knowledge. RNs study for a longer period of time, which allows for greater foundational knowledge in clinical practice, decision-making, critical thinking, leadership, research, utilization, and resource management. So as a result of those differences, the level of autonomous practice of RNs differs from that of RPNs. And since 2005, all RPNs in Ontario must earn a diploma in practical nursing by taking a program consisting of 4 semesters over 2 years in a college, which leads to a diploma in practical nursing. And also since 2005, all Ontario registered nurses must have a baccalaureate degree. So RNs either take a collaborative college university nursing program like ours, or a 4-year university nursing program, both of which lead to a Bachelor of Science in Nursing or a Bachelor of Nursing degree. So because an RN's education is more comprehensive, they have a deeper knowledge base to draw on in areas such as clinical practice, critical thinking, etc., as I explained earlier. RNs can care for patients with more complex needs in unpredictable situations, but RPNs and RNs are both integral parts of the healthcare team. And although their scope of practice is different, their contributions to the care of patients and families are both important.
Great, thank you. And we offer the Bachelor of Science in Nursing program in collaboration with McMaster University. This has been a long-standing partnership. Can you describe the benefit of this partnership for our learners?
Sure. The BSCN program is a collaborative program which is offered by the Mohawk, McMaster, and Conestoga Consortium. This is a long-standing partnership, and the 3 partners have an excellent collaborative relationship with our students, definitely experience the advantage of. So the really great thing about our program, I think, is that faculty across all 3 sites share in the teaching of all the courses across all 4 levels, which is different than some of the other programs in the province. Also, the curriculum is identical across all 3 sites, and then the degree is granted by McMaster University.
We often get asked if students are studying at the IAHS campus and in McMaster University classes. What does a day or week look like for a collaborative nursing student?
Yeah, well, classes for Mohawk College BSCN students take place at the IAHS, and also some classes like the sciences occur at McMaster University. So it's important for learners to note that the I, as we call it, is actually placed on the McMaster University campus. So everything is very close within walking distance, and there's not a lot of travel involved for classes. I would say that the days look different depending on the timetable because the curriculum again is delivered through a combination of classroom learning, in-person laboratory learning, which is in the I, and then in beginning in level 2, there are in-person professional practice placements where students then apply the learning they have gained from their classroom and lab courses. So this is the time where students are out in the clinical setting, learning what it feels like to be a member of the healthcare team.
Okay, so moving on to the Bridging Diploma RPN to BSCN degree nursing program. This is 2 parts. First, who is this program for? And is it better to apply right after graduating, or would someone benefit from gaining some work experience before applying?
Yeah, the RPN to BSCN program is intended for registered practical nurses to continue their education and obtain their Bachelor of Science in Nursing degree. We often get a mix of applicants actually to this program. We have some who have been working for some time in healthcare and wish to continue to grow and to learn by pursuing their baccalaureate degree. And then we also do sometimes have applicants who apply early after finishing their practical nursing program. The program really builds on the knowledge and skills that are acquired when working as a practical nurse. And so I do think that students who have been working for a bit of time as an RPN are at a bit of an advantage with this particular curriculum. But again, we do have a combination of both students applying.
Great, thank you. And do students in this stream complete the same courses and placements as the students who start in the 4-year degree program?
Well, students in this stream enter into level 2 of the program. And then the 2 level 2 core nursing courses are designed to assist students to transition to the baccalaureate program. So it helps with the transition. The curriculum is very similar from this point on. There are just slight nuances which are slightly different.
Okay, and if we can just discuss careers again, besides a hospital setting, can you describe other types of employment available to registered practical nurses and registered nurses?
Sure. Well, from my perspective, nursing is a career that offers many exciting opportunities depending on one's education and interests. Nursing offers you the versatility to work almost anywhere in the world in a multitude of exciting environments and positions. We know that nursing doesn't just occur in hospitals, it happens in the community, in education, in research, in public health, research and development of medical equipment and pharmaceuticals, risk management, legal fields, and many more. So I think that the opportunities for personal and professional growth are really remarkable. And based on my own experience, I know I couldn't have chosen a better career.
Great, thank you. And we often receive questions from internationally trained healthcare professionals. What routes can they take?
Well, internationally educated health professionals should always reach out to the regulating body of the province in which they live. So for example, the College of Nurses of Ontario. And the purpose of that is to understand what their options are if they choose to pursue their registration as a nurse in Ontario.
Okay, and then finally, during the pandemic, healthcare careers, long-term care facilities and hospitals have become a focus in the news. What advice or comments would you share with individuals who are considering a career in these areas?
Yeah, those are good questions. I really think that what we're experiencing now in healthcare is certainly unprecedented, and the pandemic has caused us to be more agile than ever in healthcare. but this is healthcare. So whether we're responding to health crises or illnesses, whether we're promoting health and wellness, research and education, nurses have always been an integral part of the healthcare team. And regardless of what setting we work in, that still remains the same. So my advice is don't be afraid to pursue a career in healthcare because you are greatly needed. I'd also like to say that nurses are part of both the beginning and the end of life and everything in between. So, you know, from my perspective and my experience as a registered nurse, I really believe that nursing is an amazing profession. And the ability to make an impact on the lives of so many is what keeps many of us going, regardless of where you work and what role you're in.
Great, thank you, Beth. And thank you again for your time today and for answering all of these questions. If anyone is interested in any of the programs we discussed today, please contact our advisor team through discover@mohawkcollege.ca or by calling 905-575-2460. We're here to assist you on your academic journey. Thank you again for joining us today.